Hi class, this is Micah Sorensen with my week 6 discussion on laws and regulations. Health insurance market reforms. The Affordable Care Act was signed into law in 2010. The health insurance market reforms includes the requirements to cover preventative and emergency services, the ability to use health coverage for dependents up to age 26, and some restrictions on the annual and lifetime benefit limits. The reform has enabled millions of uninsured Americans the opportunity to be insured. With this law, there has been many insurance companies that have reconstructed their programs to meet the demands of so many different families and income levels. The states enact new laws. In each state, there are different organized insurers and laws passed for the use of Medicaid and Medicare. The passing of the ACA could not have come sooner. At the peak of overpriced insurance that was rising faster than the economic growth, it went into effect right in time. Impacts on individuals, employers, and payers. These types of policies, which have significantly lower premiums, are frequently offered to individuals with lower incomes, such as part-time workers or those in certain industries such as retail or food service jobs. The impacts that insurance market reforms have on individuals is that it enables families and persons to be able to receive health care no matter their income level. Employers must offer a certain level of insurance to their employees. The payers must come up with some significant alternate to maintain their bottom line.